Thank you very much for joining me on the panel. And at least we have a lady on the panel, so it's a lot more representative. We're going to go straight ahead into it, talking about healthcare, and I want to begin from here. Do give us a quick introduction as well about who you are and what you do, and a general sense of healthcare, especially in this new dispensation we have as a country.
Thank you. Good afternoon. I'm Menomena Maina. I'm Deputy Director in charge of Nursing Services, Kenyatta National Hospital. And in this new dispensation of devolution in this country, what we are expecting is that we expect to get better services. And in the past, nurses have been very overburdened with paperwork. And we believe ICT has a role to play in the improvement of the health services, especially nursing, because a nurse is with the patients for 24 hours. And as Kenyatta National Hospital, because we are at the apex of the health sector, we want to give direction to the country. And what we have done is that we have taken heads on to implement ICT. We have developed a master plan in conjunction with the ICT Board of Kenya. We have also rolled out HMIS, it's 1 week old, and we are planning to get connected even to the wards so that we can reduce the paperwork for the nurses. The nurses are going to be having tablets as they do their rounds with the doctors, and they can be able to communicate so that we are going to make decisions on time. And we are also going to mentor other nurses, other doctors in the counties, because we are the people who are expected to give direction in this country in the health sector. We are also going to correct data, and that data after analysis is going to inform policy, and we are going to be able to come up with real policies that are going to help Kenyans get better health care.
Good afternoon. My name is Mushemu Wambugu. I'm a director with PricewaterhouseCoopers, and we are the transformation partner for the government of Kenya. And one of the projects that we are doing in one of our work streams is actually working with the health sector. So we are setting up a target operating model for the health sector, but at the same time we are trying to raise money through a PPP with one of the facilities that is going to take advantage of this being Kenyatta National Hospital. And so within that, what we're trying to do is to bring people who are going to invest in the technology that is going to be used at the hospital, and therefore we can actually reduce leakage, but also increase service delivery to the citizens. So we are very proud to be associated with Kenyatta National Hospital, but also with the health sector with regards to creating sustainable longer-term solutions for the sector.
I'm responsible at Deutsche Telekom for the healthcare section. I might spend a few words on Deutsche Telekom, which is among the 5 biggest telco or ICT companies of the world. We are the market leader in Mid and Eastern Europe, but we're also running hospitals in diverse countries like Mexico, like Brazil, Singapore, or South Africa. And we believe in what we call intelligent networks. So we think there's a new kind of infrastructure growing above brick today, and that is ICT infrastructure. And you might not know, but Deutsche Telekom, or T-Systems, the pillar, is the biggest SAP implementer of the world. And why we are in Kenya? Because we think this country is going to leapfrog what we are doing in the Western world.
Please speak closer to the mic so we can hear you.
Pardon?
Speak closer to the mic so we can hear you.
Okay, so you can understand?
Right.
Okay. So I was about to say that we are the biggest SAP implementer of the world. And we are here in Kenya because we think this country is going to leapfrog what we are doing in the Western countries, because we're such a big legacy in what we're doing in healthcare. But we can also add some of the experience, I think, to developing this country.
My interest in healthcare and seated here is really on technology financing models that we need to use or look out to to implement healthcare projects in this market. I think money has been a big issue, but at the same time, safeguarding the intellectual property that we build up, that we currently have seated in our hospitals for future use, or how to monetize that intellectual property across Africa.